Every 40 seconds, someone in the United States suffers a stroke. That is the reality of a medical emergency that does not wait for a convenient moment, nor does it announce itself with fanfare. It strikes in the silence of a morning routine or the middle of a workday, often masked by symptoms that people mistake for simple fatigue or a passing headache. This dismissal is the most dangerous mistake a person can make. When you ignore a subtle signal, you are not just waiting for it to pass. You are losing precious time. Every second that ticks by without intervention allows damage to accumulate in the brain, turning a manageable situation into a life-altering disability. Recognizing these early hidden signs is not just about health awareness, it is about survival. We are here to strip away the confusion and identify the 7 subtle indicators that demand your immediate attention. Do not wait for the classic signs. To understand why every second counts, you must look at what happens inside the skull when a stroke begins. A stroke is not a mystery. It is a mechanical failure. It occurs when the blood supply to a specific region of the brain is either interrupted or severely reduced. Blood is the life force of your brain, carrying the oxygen and nutrients required for every thought, every movement, and every heartbeat. When that flow stops, the deprivation is immediate. Within mere minutes, brain cells begin to die. This is not a slow process. It is a rapid, cascading collapse of tissue. There are 2 primary ways this disaster unfolds. First, there is the ischemic stroke. This happens when a blood clot physically blocks an artery, effectively choking off the blood supply. Second, there is the hemorrhagic stroke. This is the result of a blood vessel rupturing, causing blood to leak into the surrounding brain tissue. Both scenarios are medical emergencies. Both require instant intervention. The damage is cumulative, and the clock is always running. While some factors like age and genetics remain beyond your control, they do not dictate your entire future. The most dangerous threats to your brain are often built into the daily patterns of your life. Consider high blood pressure. Over time, this silent force acts like a constant, abrasive pressure against the delicate walls of your arteries, weakening them until they are ready to fail. High cholesterol adds another layer of danger, creating plaque that narrows the pathways blood must travel. Then, there is the impact of diabetes, which systematically damages vessels throughout the body, and heart conditions like atrial fibrillation. Your lifestyle choices are the primary levers of prevention. Smoking constricts your vessels and forces your heart to work harder than it should. Every meal you choose, every minute of physical activity you commit to, and every decision to manage your blood pressure is a direct act of defense. You are not a passive observer of your own health. By identifying these triggers, you gain the power to intervene before the emergency ever begins. You have likely heard of the acronym FAST. It is a standard tool for identifying a stroke. Face drooping, arm weakness, speech difficulty, and the time to call emergency services. It is a vital framework, but it is incomplete. If you rely solely on these 4 indicators, you are missing a vast, dangerous spectrum of warning signs. Many people dismiss subtle, early symptoms as minor inconveniences or temporary fatigue, but these are often the body's first, desperate attempts to signal a catastrophic failure. A stroke does not always announce itself with a dramatic collapse or a visible facial droop. It can manifest in ways that are quiet, confusing, and easily overlooked by those who do not know what to look for. These less obvious symptoms are just as lethal as the classic signs, yet they are frequently ignored until the damage is already irreversible. Recognizing these hidden signals is not just about medical literacy. It is about survival. You must be prepared to see the warning before it becomes a crisis. We are moving beyond the basics to uncover the 7 hidden signs of stroke that you must act on immediately. These are the subtle, unexplained changes that demand your full attention, because in the landscape of brain health, the smallest shift can be the difference between a full recovery and a life-altering disability. The first hidden sign is a sudden, severe headache. This is not the dull ache of stress or the throb of dehydration. It is an explosion of pain, often described as the worst headache of your life, appearing instantly without warning. Sometimes, this agony is accompanied by intense dizziness or sudden vomiting. This is a critical indicator of a hemorrhagic stroke where a blood vessel in the brain ruptures, causing internal bleeding that demands immediate intervention. Do not wait for it to pass. The second sign involves sudden, unexplained changes in your vision. You might experience blurred sight, double vision, or a complete, sudden loss of vision in one or both eyes. This is not the result of eye strain or fatigue. It is a neurological failure. When the brain's visual processing centers are deprived of blood, the world around you can distort or vanish in seconds. If you or someone near you experiences this level of pain or sudden sensory loss, call emergency services immediately. The third hidden sign is sudden dizziness or a total loss of balance. You might feel a wave of vertigo pull the floor out from under you, making it impossible to stand straight. When you try to walk, your legs fail to track, causing you to stumble or veer sharply to one side. This is not simple lightheadedness. It is the cerebellum, the brain's center for coordination, losing its blood supply. If you cannot walk a straight line or feel the room spinning violently, your brain is struggling to maintain your physical position in space. The fourth sign is sudden numbness or weakness, localized to one side of the body. This is a subtle but lethal warning. You may feel a persistent, crawling pins and needles sensation in your arm or leg that refuses to fade. It can manifest as a heavy, unresponsive limb that will not obey your commands, or a sudden slackness on one side of your face. This is not a cramp or a temporary nerve pinch. It is a direct result of the brain's motor cortex being deprived of oxygen. If you drop a glass because your hand suddenly loses its grip, or if your leg gives way without warning, you are witnessing a neurological breakdown. These physical failures are not minor inconveniences. They are urgent, life-threatening signals that require immediate medical intervention. The fifth hidden sign is sudden confusion or a total breakdown in understanding. You might find yourself unable to follow a simple conversation, or you may struggle to process basic commands. This is not the fog of exhaustion or a momentary distraction. It is the brain's language centers losing their ability to connect thought to action. If you or someone you know suddenly seems disoriented, unable to name common objects, or stares blankly when asked a direct question, the brain is in crisis. The sixth sign is sudden trouble swallowing. This is known as dysphagia. You might find that liquid or food catches in your throat, causing you to choke or cough violently. This is a motor failure in the muscles of the throat, a direct result of the brain losing control over involuntary functions. It is a dangerous sign that can lead to airway obstruction. The seventh sign is sudden, profound fatigue. This is not the tiredness of a long day. It is an inexplicable, heavy exhaustion that hits like a physical weight, often localized to one side of the body. You may feel your energy drop to zero in an instant, leaving you unable to lift your arms or hold your head up. When a stroke occurs, the clock starts ticking immediately. Every second of delay allows more brain tissue to die. The treatment path depends entirely on the type of stroke. If it is an ischemic stroke caused by a blood clot blocking an artery, medical teams act to restore blood flow. They may administer a powerful clot-busting medication known as TPA. This drug travels through the bloodstream to dissolve the obstruction, but it must be given within a very narrow window of time. In more severe cases, doctors perform a mechanical thrombectomy. This is a precise surgical procedure where a specialist threads a catheter through the blood vessels to physically grab and remove the clot from the brain. If the stroke is hemorrhagic, caused by a ruptured vessel, the strategy shifts. The priority becomes controlling the bleeding and reducing the dangerous pressure building inside the skull. This often requires immediate surgical intervention to seal the vessel and stabilize the brain. There is no home remedy for these events. You cannot wait to see if the symptoms pass. You must call emergency services the moment you suspect a stroke. Paramedics can begin life-saving protocols while you are still on the way to the hospital. Time is brain. Your quick action in calling for help is the only way to ensure the medical team has the chance to intervene before permanent damage occurs. Do not hesitate. Call now. Beyond the immediate crisis of a stroke, Your best defense is a proactive lifestyle. Preventing a future event starts with what you put on your plate. Prioritize a diet rich in whole grains, fresh fruits, and leafy vegetables while strictly limiting sodium and saturated fats. This is not about temporary restriction. It is about keeping your arteries clear and your blood pressure within a healthy range. Pair this with consistent physical movement. Aim for at least 30 minutes of moderate exercise most days of the week. Whether it is a brisk walk, swimming, or cycling, keeping your heart rate up strengthens your cardiovascular system and improves circulation. If you smoke, stop. If you consume alcohol, limit your intake. These choices directly impact your risk profile. Furthermore, manage your chronic conditions. If you have diabetes, high blood pressure, or high cholesterol, work closely with your doctor to keep these numbers in check through medication and regular monitoring. These are the tools you have to take control of your health. This video is for educational purposes only and does not replace professional medical advice. Always consult your healthcare provider for concerns specific to your health. If you found this information valuable, please give this video a thumbs up and subscribe to our channel for weekly health education. Most importantly, share this link with someone you care about. That single act of sharing could provide the knowledge someone needs to recognize a stroke and save a life. Stay healthy, stay vigilant, and we will see you in the next video.